a mission to inspire. My name is Shola Ajibade, and with me today, I've got Dr. Wumi Fagunwa. Hi, Wumi, you're welcome to the show.
Hi, everyone. Thank you for having me.
I'm just gonna do a short introduction. So Wumi is a medical doctor. She's an award-winning medical doctor. Wow. A women's health advocate. She's the founder of Shakeafrica project. She actually graduated from UCL Medical School in 2020. And she's also got BSc in neuroscience from King's College in 2029. She sits on the board of trustees for Sexpression UK and Young Women's Advisory Council for Forward UK, the leading African women-led organization working to end violence against women and girls. Interesting. Wumi has been recognized as one of the top 5 rising stars in health in the UK. Wow, wow, wow. You've got a very impressive profile.
Thank you. Thank you.
Wow, you graduated in 2020 and you're doing this project already.
Yes, I mean, you know, when I graduated class of Corona, so I had a few months on my hands in lockdown. So I thought this was the ideal thing to be doing with my time.
And it's good though, because at the end of the day, you're helping your community. You're helping those who are actually in need at the time, something that really touches you and you really want to help out. So it's really good. Can you tell us a little bit more about yourself? I mean, if there's anything more you want to, add to what I'd already said.
I mean, honestly, I think you've covered it all in terms of what I do, sort of work-wise. I guess in my spare time, I just spend a lot of my time watching TV, shows. And eating. So if anyone that knows me knows those are things I really enjoy doing my time as well.
Okay, so your foundation, Shakeafrica, what is it about? What's the motive behind Shakeafrica?
So Shakeafrica, it's an organization that's really centered around improving sexual and reproductive health outcomes in Nigeria. Well, we say across Africa and then in the diaspora, but our main focus is Nigeria. So we operate over there, but we also operate within the African and Caribbean communities in the UK as well. And our key focus is just trying to improve health outcomes amongst women in particular, but really amongst everyone. I think sexual and reproductive health is very much overlooked, particularly within our community, but they are actually really important in terms of our well-being in its entirety, and particularly in Nigeria. Adolescent pregnancy, we have quite a high adolescent pregnancy burden, and because of societal and cultural factors, there's low contraception uptake and there's low understanding of contraception, but also things like periods, gender-based violence, consent. So Shakeafrica really aims to improve awareness about these issues, to educate people on these issues, and yeah, that's what we do.
That is really, really, really great. Very impressive. Seeing a young graduate like yourself, I finished from UCL Medical School in 2020, running a charity project which impacts on a section of, serious concern in our community. Is very impressive. Not just our community. In fact, it would be across across a continent, which is Africa in particular. That's really, really impressive. I know I asked this question before, but from what you've just said now, can you enlighten us a bit why you actually chose this particular project, because there's so many other projects that you could have done, but you chose this one, and I'm sure it's very dear to you, very dear to your heart. So can you just tell us a little bit more?
Of course. So actually, before I did any of this, so you said that I'm on the board of trustees for Sexpression UK, but actually before I even was on the board and things like that, I was volunteering for them in my university days. And actually that's where this idea sort of started to crop up for me, just because we were doing sexual and reproductive health education. At the time I was in Belfast, we were doing it in Ireland. And it really just, I started to think more about Nigeria. And I was like, if here we have such poor understanding of our sexual and reproductive health, that it's great for me to do it here, but honestly, I'm Nigerian, and so I've always had a passion and a love for Nigeria and for, African women. I was raised by an African woman. I was raised by African, parents, and they've always ensured I had a really strong tie to Nigeria, and I've always wanted something that I was doing there. And so then this cause was something that I've just actually really been interested in always, just in general. I've always had an interest in women's health, probably because I'm a woman, and so these issues also affect me as well. So really I just think that this is something that we don't talk about. It's overlooked, and it's something that's so important. Like, I have come across so many young women that just have had to drop out of school, or who really struggle because they just haven't had the conversations. And Nigeria, there's such a high rate of unsafe abortion. And it really, I don't know, it's just something that I think that is a product of some of the issues that I've already spoken about. And we carry 14% of the burden of maternal mortality in the world, which means that my sisters in Nigeria are dying from things that they shouldn't be dying from. And I think that's where my passion comes from.
Oh, right. Very impressive, though. This is one section that is kind of hidden under the carpet. It's not something that is talked about a lot. So for you to create an awareness, and I know that you've done a few projects where you've actually tried to reach out to people to support this project. That's really, really impressive.
Thank you.
What is your support mechanism? What is your support mechanism? Because I know you won't be doing this all by yourself. I know it's your baby, it's your dream. There has to be something supporting you.
It's impossible to do this by myself. Honestly, there's no way. So obviously I would say, okay, first and foremost always has to be God. I think, just committing like all your plans before you do them, I commit them to God. And I think people find that a bit funny, especially because of the topic of the foundation, but everything was created by God. And so in all honesty, that's number one. Just, committing all my plans to him before I go ahead. And then after that would be my family, people like you, obviously. People like you, obviously my parents, my sister, they've been really supportive, and particularly when Shake started. I started Shake when I was in medical school, so I had no financial anything, obviously. I had no earning, whatever, and they really supported me. They supported me financially, they supported me in terms of just concepts and things like that. And then also I've got a really great team of volunteers that are working in Nigeria, that are on the ground, and that are really my eyes and ears for everything that's happening in there. And then my friends as well. And I've got great friends who also are very, very supportive, people that I can collaborate with on projects. It's really great just to be able to call people up and say, hey, let's do something together. And they're always really forthcoming. So that's really my support system.
That's great. So how do you reach out to Nigeria to do the project? Because I know you're based in the UK.
So do you know what? That's actually, it was something that was quite difficult, because obviously I'm based in the UK and I've been born and raised in the UK. So I wouldn't say I had a massive network within Nigeria, but really it's using the network that you do already have. So obviously my parents as I said, I've got Nigerian parents, and they spend a lot of time in Nigeria, and they've ensured great ties. So often I ask them, I reach out to their network, and also the great thing is social media. Social media has really transformed everything, because I can connect with so many people.
That's great,
and even like recruitment wise, recruiting the volunteers, we just did that via social media. And actually some of the people that are on the team are people that have reached out to me on LinkedIn and said that they're interested in interning with us and things like that. So social media has been really key in being able to interact with people that are in a different space.
Wow, impressive. In terms of your projects, is it for young girls, or is it women in general, female?
So that's a good question, because actually for a long time we really tried to figure out who we're trying to target. And so actually Shake has different arms, and we have different things that we do for different people. So one of the things that we think is really important is age appropriate education. So we do have our where it comes to our educational arm, where we reach out to people in schools, that's very much targeted at younger women, young girls, particularly things around, not all things around menstruation, but particularly things around menstruation, trying to get them when they're first starting to menstruate, and they're going through puberty and they're changing their bodies. And also because particularly in Nigeria, where they sort of go to university at a younger age, we try and capture them at that age because they will be in university with people that are older or have had more experience in the world, and people who have had these conversations already. So trying to get them before they get there. And then we do also target, just young women women in general, across the age, all ages, because there are different issues. Like, people sort of forget that women sort of over the age of 50 also have sexual and reproductive health needs, and it's not just menopause. Menopause is obviously one of them, and it's something that's not spoken about, but also they still have sexual health needs, and so we try and cater to pretty much everybody across the board, just in different ways.
Wow, that is really impressive for you to stretch your tentacle across the board. That must have been quite, I don't know if it's difficult for you to do at start, but I think for most people, it might be a difficult thing to, start on a broad scale. How was it for you?
So you're right, it is difficult, and it's not something you can't cater to everyone at the same time, at least where we are currently. So we do have our key focuses, and then we will do things that touch on some of the other issues as well. So if you just, even by looking through our social media, you can see that our key demographic sort of runs between you have a bit that runs between the 13 and 16 range, then we have a key demographic sort of from 18 to 35. So you can see that, and then we will touch on some of the other things. So it is quite difficult, especially when you're quite a small team, to go across the board. But what has been really great is the fact that, because we're trying to target young people who are, very much like teenagers, very young teenagers, their parents are quite involved, and that's a unique opportunity to speak with their parents. So at one of our outreach events, actually, what was really useful was speaking to parents of young people, speaking to these parents about sexual and reproductive health, about contraceptive issues, about how that affects their young children. And they were very much engaged, but also they were engaged for themselves as well, and were learning new things. So we are quite uniquely placed to be able to target people across all ages.
Impressive. That's great. Since starting your project, any regrets?
Honestly, I try not to have regrets, and if I'm honest, I don't have any regrets. I think it's been a really, really steep but a useful learning curve, and I have learned a lot along the way. I'm by no means, you already know that all I have really done is I've done neuroscience, I've done medicine. I don't really have experience of running an organization prior to doing this. So this has really been a huge learning curve. So no regrets. Obviously I started just before COVID. So COVID has been, not the easiest waters to wade. But again, it's a really great opportunity for me to learn kind of how to work when you've got the unexpected in front of you. So no regrets. I'm just looking forward to what's to come.
That's great. Any positive highlights you like to share with us today?
Positive highlights. Oh gosh, there are many. So I think, do you know what? Actually getting Shake off the ground was probably one of the greatest highlights for me. Just the fact that we could exist, it was like an idea for a long time, and to be able to just actually execute and actually do it, that's been a huge highlight. I've got a few. The next one I'd say is doing last November, we did 16 days of activism, and I partnered with one of my good friends, Wumi the medic, and we did a 16-day campaign that was all about ending violence against women and girls. And I just had the most amazing time, met some really incredible people, learned a lot about the issue as well. So that's been a huge highlight. And this year our big highlight has been being able to raise money for cervical cancer screening in Nigeria. I've been really, really excited to do that. Really excited. We've had 60 women so far who've had their cervical screening for free. And it's something that we get for free here. So I'm so happy that it's something that there are women in Nigeria who have had access to it that wouldn't have had access to it otherwise.
Wow, that is really great. With the cervical screening here, as you said, it's free.
Yeah.
So is it free across the whole of Nigeria, or is it a particular state?
So, unfortunately, with Nigeria, it's not free. And a lot of the times that it's free, it has to be subsidized by, for example, a charity, an NGO. So it's not free, and then it's also not as widely known about as one would hope. So those are two issues that are like sort of Nigeria's tackling, and it's a massive cancer killer amongst young women. Cervical cancer is the biggest cancer killer amongst young women under a certain age, and particularly in 20s and 30s. And so it's important that they get it, but it's just not free. And it's quite expensive if you think about it. If you translate it into think about how many people are living below the poverty line in Nigeria, and think about how much it actually costs to get screening, people will choose to eat, because not eating and starving is more of an imminent threat than cervical cancer is.
That's very true. But for you and your team, creating that awareness, for now, it's a massive thing, because if people are aware that this thing exists and they need to go for this screening because it can or could save their lives, that is a very, very great achievement for your project.
Thank you very much. And if anyone wants to donate, please, anyone wants to donate to cervical cancer screening, then find the Shakeafrica website.
I was gonna touch on that next anyway. So my next question would be, if we want to support you, how can we support you?
So guys, there's many ways you can support Shakeafrica. You can support us with your time. We're always looking for new volunteers, people that want to get involved in the cause. So if you are interested, you can find me either on LinkedIn, or you can find us on our social media. So all of our social media is Shakeafrica. So Instagram, Facebook, Twitter, LinkedIn. Also, you can find me if they're Wumi Fagunwa on LinkedIn as well, if you are interested. Also, our website www.shakeafrica.org. You can find all of our information there, how to volunteer, and obviously how to donate. We have a few causes that you can donate to, and no amount is too small and no amount of time is too small. So we appreciate anything.
Thank you, thank you, thank you. You said there are a few courses that people can donate for. Can you shed light into that? What courses are there?
Of course. So we have, we do different, so as I said, we have different arms. So we have our, first and foremost was a cervical cancer screening project. So people can actually donate to that. They can donate to helping us raise money to fund cervical cancer screening. And as I said, that's been really wonderful. And we've already screened 60 women this year with in partnership with Whisper Health, who are on the ground in Nigeria. So that's one way, one thing. Also, we run something called the Adebanke Fund, which is basically a way of trying to encourage young women who find themselves in a position where they have where they are pregnant, particularly in adolescent years, and it's a way of trying to support them in staying in school and being able to reach their educational potential. So be that through giving them access to educational opportunities like night schools, or finding alternative ways for them to stay in education, and also just trying to provide some monetary support as well in the way of antenatal care. So that's another cause that people can donate to. Then obviously just the day-to-day runnings of Shake Africa, we're not able to run without everybody's support, and so generally just supporting us in that as well. And then we do run a scholarship for young people who do want to know more about sexual and reproductive health, and you can also donate to us trying to get young people who want to do, for example, a master's in it, to be able to help fund some of their even if it's just paying for books and things like that, to help fund them to be able to continue on with this course.
So how do you do this? How do you combine your profession and your projects? How do you combine both?
So I'm not going to pretend it is actually quite a difficult balance, but so there are a couple of things though that can help. So the first thing, originally, actually, I'm actually full-time now, but originally I was working at 80% and trying to use the time that I, wasn't working to do this. Right. But I've just gone up to 100% just because it's still a training program, even though, so once you qualify, you still need to do your training. And so so I can get my training done. That's why I've gone up to full time. So that's one thing that I did. But also, it really is using everybody around you. And honestly, you need to use everyone around you, because otherwise it's really quite difficult to get things done, particularly if you're on call on night shifts, blah, blah, blah. Very difficult. But also a really great thing I do is I use my commute. So if I'm on the train, for example, yes. I can actually just do a couple of things on the train, and then on the way back, or if I find a quiet moment where things aren't, going off in the hospital, which is rare and nearly never happens, then I will try and do something then. So yeah, and annual leave, when you get your annual leave, you'll use some of it. But that being said, also it's resting. That's actually the key thing, because if you're so tired, there's no way you can actually be productive. So me, like I said, I like watching TV and I like eating. So when I get home in the evening, you will see me, I will watch TV and I will eat, because once I'm well rested like that, I can actually do my work effectively and efficiently.
Right. You like eating, doesn't show.
Oh, Auntie, don't worry. The camera only shows you so much.
I've known you for quite some time now, and you are still the same with me. You haven't grown bigger.
Oh, I have. I promise you.
We'll be coming to an end, but before we do, and thank you, by the way, for joining us today.
Thank you.
Before before we do, any piece of advice for our viewers aspiring to do something similar to what you're doing?
Honestly, I think the only advice I can really give to people is just to do it. If you don't try, if you don't just take the plunge, you'll never know. Anybody that knows me knows I'm a little bit I can be a bit shy, I can be a bit reserved, and this isn't my natural this isn't this wouldn't be my default position or anything. I would really, it's out of my comfort zone essentially, and I think everybody should just step out of their comfort zone, because you'll be surprised by the things that you can do and the things that you can achieve. So don't let fear be a blocker, or don't feel like you can't do it. Don't let imposter syndrome get you, because I think it gets a lot of us, and we think that we shouldn't really be in this space, or we're not good enough to be in the space. But God deems you good enough to be in this world. You're good enough to be in any space, and so you should be bold, take that step, and I'm sure you guys will all shine.
Thank you so much, Dr. Wumi Fagunwa. And by the way, I'm so proud to say that Dr. Wumi Fagunwa is my cousin.
I'm so proud to say it too. I'm your favorite as well. I better be your favorite.
Of course, you're one of my favorites.
One of the favorites. Everybody, please know I am the favorite.
Okay. Thank you so much for joining us today. We really appreciate your time and all that you've shared with us. And we are sure that you've actually inspired us today to go out there and do something, no matter how difficult we think it is, we should at least try. Thank you so much.
And thank you for doing this. I think this is a really great initiative and venture, and I've already enjoyed watching, and I look forward to all the future episodes. Probably I won't watch mine, because then I'll just feel embarrassed, but I'll watch all the other ones.
Thank you so much, Wumi.
Bye,
everyone. Goodbye.